Hello, my name is Andre Ward, and I'm the Associate Vice President of the David Rothenberg Center for Public Policy at the Fortune Society. Welcome to Both Sides of the Bars. During this time of COVID-19, we hope that you and your family members are safe and well, and that everyone is practicing social distancing. Today's episode is timely. We're going to be reviewing a webinar to look at COVID-19, Rikers Island, and technical parole violations. This is a segment and this is a webinar that you do not want to miss. Please listen in intently and we'll be able to talk with you soon. First, I just want to start by thanking everyone on this panel. Assemblyman Mosley, Sarita, Daftary-Steel, Schiraldi, Tahanee, Dunn, Sharon, Vincent, Dr. Bobby Cohen, Stoughton, and Mr. Marcus Brown. I just want to thank you for joining this panel today and this webinar, just to share your thoughts and to give some analysis, to share an analysis around COVID-19 and technical parole violations. I know each of you in your respective engagement and work have done something about this, is in action with doing something about this, and is looking to empower others to be change agents to make the conditions better for people on Rikers Island who have experienced technical violations, people who have been released from Rikers Island to the community. So I want to thank all of you for joining this panel. As we know, the staunch spread of infection of COVID-19 has occurred inside of Rikers Island. We know that there are many, many cases that have occurred on Rikers Island that have both impacted those who are detained there as well as the correctional officers. So the panel is rather diverse. I thought this with talking to someone who was actually just released from Rikers Island and has had the direct experience of witnessing what is going on there as a lead to that. So joined on this panel is Mr. Marcus Brown. Mr. Marcus Brown is also a part of the Fortune Society. So Mr. Marcus Brown, thank you so much for joining us today here for this webinar. And I just want to ask you, Mr. Brown, talk to our listening audience about what you experienced while you were in Rikers Island. We're thankful that you came out safe and that you came to a space where you were able to be supported. So talk to us, Mr. Brown, about your experience on Rikers Island, what you have witnessed while there as it relates to COVID-19.
You're welcome. First, I want to greet everybody with peace. My experience at Rikers Island was from January 10th to April 2nd when I was released. My story is quite extensive, and I know we have a brief amount of time, but I was in AMKC C95, and a week before I left, they had hung a letter on every door signifying that it was an isolated living area. This is after the last reports that there was over 100 inmates that tested positive and 100 officers that tested positive. I had access to the whole building, even after our house, each area was listed as isolated, meaning that we wasn't supposed to have no interaction with the rest of the population. However, through the policies of the building itself, we was allowed to interact with each other. They still ran medication. I was a mess hall worker, and I went to every house. This is how I actually saw that every house had an isolated living area on it. One of the experiences I had real briefly, do I have enough time, Andre? Or should I just go ahead? Well, one of the last experiences I have, I think that's most significant is that for those that's concerned about what actually took place on Rikers Island and how the virus was allowed to spread. We went to sick hall one day. And when we got there was 5 of us because that was a policy of the ward that only 5 people could go at a time. They didn't have any apparatuses to take out temperatures or anything. All they did was take out blood pressure. And I told them my lung was hurting. Other individuals had flu-like symptoms. They didn't take out temperatures. They just sent us back to the living area, and they didn't give us no medication or nothing like that. 2 days later, one of the individuals that went to sick hall with us, he fell out. And he ended up actually being tested positive for the coronavirus. At that time, first they were sending them from West Facility to Bellevue, but then they stopped. They opened back up the ETMC Center, which is C76, which they had just closed when city inmates used to be housed, or city centers, rather. But they opened that back up for those that were tested positive to quarantine them. And he was sent there. We was informed this by the officers that came back to get his property. That's just some of the brief things. I don't want to take up too much time, but my story is quite extensive. And I hope whatever information I have will be useful and that something can be done further to better, because I noticed they stopped speaking on the news about anything about Rikers Island, about what's going on. And when I left, in the building I was in, there was definitely, because that's why they hung the letter on every door, there was definitely somebody in every house that tested positive, because that's what that meant. And we were still allowed to interact with everybody. And we was even released. There was a segment of us that had symptoms. I had symptoms from the day I was released. So that means that the governor, because I was released by the governor of the state of New York, or rather, the writ was put in for me by the New York County defenders. But the governor allowed 600 people to be released. The mayor allowed about 500 city sentence inmates. And there was a segment of that population who definitely was infected by the coronavirus that was allowed to be sent back to the community, thereby contributing to the infectation of our community, family members, and even a death rate, which definitely probably happened. But that was because of the policy and procedures. Whether it was known or unknowingly, I'm not trying to slander anybody, but I'm just going to end with that. And hopefully at the end, I can give some suggestions what I think might be done, but that's probably irrelevant at this day and time, because the whole Rikers Island is probably infected entirely at this moment. Because at the time that I left, just my building alone. And when I spoke to other people that was released, they said the same thing was happening in their buildings.
Sure. And thank you for that. And I want to transition to Dr. Bobby Cohen for a minute. You know, when we're talking about mass exposure to COVID-19 on Rikers Island, right, it's noted that one person can infect 1.2 people, according to some of the research I've done. So Dr. Cohen, talk to us about that, like the impact of that exposure, right, and some of the implications there, and other comments.
I'm going to begin to say I'm speaking on my behalf, not on behalf of the Board of Correction. We have been publishing daily public information. We've been collecting other information for a longer period of time. We will try to increase the amount of public information that we have out. It is an extremely contagious disease. And right now, the Rikers Island is divided into essentially 4 groups. We all know, everybody here knows all the different categories that there are on Rikers Island in terms of disciplinary and ESH and MOs and CAPS and PACE. Fundamentally, there are people who have been COVID-19 positive. And right now in Rikers Island, there are 362 of them. This is out of a population of 4,000 plus or minus. There are 2,000 of those 4,000 who have been in dormitory areas like you just described, Marcus, where someone was found to be positive or suspected of being positive. And that dormitory is then labeled quarantined, possible exposure to COVID virus. We do not know how many people in your dormitory were infected by the person who was taken out. And then there are people who are symptomatic and are awaiting testing. And then there's the 4th group, which is everybody not in those first 3 groups. People who are positive, people who are symptomatic, waiting the results of testing, 2,000 people who have been exposed at some level because they lived in the same housing area as someone who was either positive or symptomatic, and then other people, which is
the symptomatic number.
What?
You said 2,000 are quarantined because they've been exposed, 362 are positive. And then there was another group of symptomatic. How many are symptomatic?
143.
How many?
143. 143. So the answer to the mental question here, Andre, is that I don't know how many people are infected on Rikers Island. The policy on testing, and again, I want to say that and I've been criticized for this, but the people in the medical services there and the people who are working there are doing an extraordinary job, despite what you described, Marcus. And I believe what you described happened, and I'm very concerned about it. But you know, there are 775 DOC staff who have been COVID-19 confirmed, and this is as of yesterday, and 123 members of the medical staff who become infected. So if you're there on Rikers Island, your chances of getting infected are very high. I think maybe there are other things I can talk about, but was that responsive to your question, Andre?
Sure, and thank you for that data, Dr. Cohen. We appreciate that. And I want to transition to Sharon White-Harrigan. And Sharon, and I apologize for not introducing you, Dr. Cohen, like your affiliation, but Sharon White-Harrigan is the Executive Director for the Women's Community Ministry. And I know that you work with, obviously, working to advance, lift up the issues that are impacting women, especially those who are Rikers, and in Bedford Hills upstate as well. So Sharon, talk to us about some of what's happening with our women in Rikers, in Bedford Hills, et cetera.
First, I want to say hello, everyone, and it's an honor and a pleasure to be on the panel with all of you. Not much, right? So, as always, women are always under-acknowledged, overlooked, underrepresented. And so we can't get a whole lot of information about the women that's upstate, right? They've been closed off. We have gathered almost all the resources that we know that we have. And it's not just WCJA, it's, a little piece of light. It's the Women's Prison Association. It's, New Hour. It's CC. I mean, we all have tried to, get some information on what's going on, right? And we can't get a whole lot. We got like 36 names of women who are over the age of 50. And we're talking about 3 state facilities for women. So that can't be accurate. So right now we're still pulling teeth with the women. There's 166 women that is on Rikers Island at the Rose M. Singer Center. 17 of them are detained for technical parole violations. 6 of them are city sentenced, and 119 of them are still pre-trial. And 7 of them, from what we have gathered from the Board of Corrections update, that 7 of them are confirmed cases, and about 110 of the women are likely exposed but asymptomatic.
Yeah, and I know that it's really alarming, the lack of attention that's paid to women who are on Rikers and who are upstate and in prison, especially our women who are among the aging population who are older. And so I know we're going to talk a little about parole, and I'll circle in with Lorenzo and obviously Vinny, who are like leading some things. And certainly we have Assemblymember Mosley who's joined us. Again, thank you so much, Assemblymember Mosley, for joining us too. And your feedback is critical to this conversation. As an elected official, you have been behind and supporting less is more, and by extension, parole reform, et cetera. We want to acknowledge you for that. But I want to talk to like our lawyers who are in the house, right? So we have Tahanee Dunn and we have Corey Stoughton who are on the phone. And Corey, I'm going to turn it over to you. Corey, I know that you're heading up as the attorney in charge of the Criminal Defense Practice Special Litigation Unit at Legal Aid. I know that Legal Aid just won a victory with 51 people being released. Just really want to acknowledge the work that Legal Aid Society has done. And then we'll shift to Tahanee for what Bronx Defenders is doing. But Corey, talk to us about that experience, right? Litigating to get 51 people released, folk who are a certain age, right, older population and have different medical conditions. Talk to us about what that experience is like and what you all are doing.
Yeah, thanks. So actually, all in all, we filed a series of writs for hundreds of people on Rikers Island, and all in all have gotten, including Mr. Brown, yeah, it's nice to meet you in person, Mr. Brown, and gotten actually 172 people released in total across all those writs. We haven't won all of them, so judges are denying some of our writs. These hundreds of people are all people who are medically vulnerable in some way according to the CDC criteria. So they could have asthma, they could have other conditions, or they could be of an age where their age makes them particularly vulnerable to bad outcomes from getting COVID. So, and we actually were following the lead of the Board of Corrections on this when, at the very, very early stages, the Board of Corrections came out and said, you need to release all these people who are over 50 and have kind of, other conditions that make them vulnerable. And that, the system wasn't really moving. So we started filing writs of habeas corpus arguing that the Constitution, actually the constitutional right to be free from, punishment and to have your, to be free from what they call deliberate indifference to a serious medical need requires release, which is really, like, from a lawyer perspective, an extraordinary argument, because I think people probably know that in prisons and jails, you file constitutional claims like this if someone's very ill in prison and the prison is failing to treat them altogether. But usually what you get out of that is treatment, right? So there's lots of cases where prisons, won't treat someone with, say, hepatitis C. So you should be getting hepatitis C medication. This was a really kind of a step farther in asking judges to release people from jail because of the medical risk. And what we've seen is that some judges are willing to do that because they know it is necessary and it's an extraordinary circumstance. But we still see that many judges aren't. And that's really unfortunate. So that's one of our strategies. We've, more broadly, legal aid provides representation to the vast majority of people accused of parole violations. And one of the things that we saw that made this problem worse for the parole community is that after COVID hit, the parole system really ground to a halt. And that's because the hearing process was, for those of you who have been involved in representation or in the system, that the hearings take place on Rikers Island in these tiny little rooms. Social distancing is just not possible, and they're not the cleanest places. So because they didn't move quickly at all to try to make a system work to kind of keep cases moving forward, what happened was the system just collapsed for about 2 weeks, and nothing happened. And also during that period, a lot of people came into the parole system, because docs didn't stop violating people, even though people called on them to stop this, especially technical violations, stop feeding the system, where we know that Rikers is going to be a very dangerous place for people there and actually our broader New York community. Docs didn't stop. So we had people coming into the system, but there was no system. And to this day, there are many hundreds of people who are in Rikers now in technical violations who don't even have a lawyer because they kind of got lost in the system. And it's something we really remain very worried about, because we can't file writs on behalf of people when we don't know who they are or how to get in touch with them. And we get calls sometimes from family members or from people calling a hotline and legal aid hotline, but a lot of people are right now, I think, are really lost. So we're really worried about that. The governor, one of the things that happened was after we won our first writ for 106 people in on technical parole violations, about 5 hours later, the governor announced that he was going to review people in jails on technical violations. And that has now happened. And the governor says he's released about 700 people statewide, including about 264 at Rikers, although we think his math might be a little sketchy, but anyway, he has released quite a number of people. But they denied the vast majority of releases, even people who were just in on technical violations. And they did it, the criteria they applied were really restrictive. You had to, for one thing, just off the top, they weren't even considering anybody with what they call an M designation. So anybody with a diagnosed mental health issue, which, I think is extraordinary, because just because you have a mental health issue, I don't know why that means you should spend your time in Rikers. So it doesn't make any sense. They didn't release people who, unless they could demonstrate housing, which is a really high bar for a lot of people to meet. And they weren't really, they haven't, anyway, they weren't, you had to come up with that on your own. And then they also applied, a public safety analysis that, I think probably just got that calculation wrong in a lot of cases. And we had some clients that we knew the records of, and we were baffled, really, that the governor was kind of resisting releasing them. So we tried to kind of pressure that system to move faster, and we keep trying to pressure it every way we can. We filed some other writs on behalf of people who were sentenced, parole, people involved in the parole system were sentenced to treatment, who then got stuck at Rikers when docs stopped transferring people. And we actually won the release. That was another, I think, 50 some people that we won. Actually, it might have been, I've got my numbers all mixed up, but it might have been 38 people. But anyway, several dozens of people who were stuck at Rikers who should have gone to Edgecombe for treatment programs, and we got them released. We tried to file a writ on behalf of people who've been denied a preliminary hearing, which you're supposed to get in 15 days, but we lost that writ, unfortunately. So we keep just trying to kind of push the system to kind of get more people out, as many people out as possible, because, for all the reasons that Bobby Cohen said and others have said, it's just a dangerous place to be. And the fact that we're feeding people in to the system at all is really outrageous, but especially that we continue to feed them in on technical parole violations. It's just mind-boggling.
Sure, and thank you for that, Corey. And I want to transition right to Lorenzo, right? Because you talk about pushing, you're talking about technical parole violations, the idea of less is more and the movement that's happening. Lorenzo Jones joins us from the Katal Center for Health, Equity, and Justice. They've been advancing less is more as it relates to technical violation and parole reform. And we're going to get to, obviously, our social scientist, Vinny Schiraldi, who has written extensively about parole reform generally. But Lorenzo, I want to tie into, like, segue away from what Corey's talked about into what less is more is doing, what Katal is doing with less is more. And then I want to get right to you, Assemblyman Mosley, following Lorenzo, because I know you're sponsoring the bill around the Less is More Act, and then we'll get to Vinny and others. So Lorenzo, talk to us about what the Katal Center for Justice is doing around less is more. What is it? It's 11:25, just to let everyone know. We try to move as quickly as we can, but I want to make sure everyone gets it. So Lorenzo?
Yeah. Morning, you all. I'll just be a couple of minutes. And I had to tell you, in the span of 5 days, probably the most significant thing we've learned is that the information the folks in Albany are getting about, and I'll let Vinny speak to this because he knows this stuff, and we had a great call Friday, but the information that our legislators are getting up in Albany is not the information and understanding, right, being shared with us, right, on the ground as far as numbers and infections and release. We had, unfortunately, 2 people pass, right, in the last couple of weeks. Like, that's been like a major thing for us. I'll let Vinny talk about the numbers because he can just speak to them with much more authority. But what we've done is activated our phone to action stuff. So people are online, find your legislator, tweet your legislator, call your legislator. We've had our staff, policy folks calling through legislators, calling through city folks and trying to figure out and talk to them directly and their teams directly around what we should expect for the back end of the session, what kind of things we can be, what kind of action we can be taking to, like, get their attention. And then lastly, probably the most concrete thing that we've done or found out, and this was in a staff meeting this morning, is not only have over 30 people, and I'm sure much more than that, have been sent back for technical violations. People are being held there on, like, BS technical violations, but also now we've got the issue of the police, NYPD, making arrests under the stay-at-home orders for people who were kind of out, and, like, now we're looking at this other crap. So we went from, like, you couldn't do misdemeanor stuff, you couldn't, like, hold people for misdemeanor stuff, to almost like a resurgence of some of the ugly policies we saw done away with, like stop and frisk, backhandedly. So I'll stop there and kick it to Vinny. But yeah, we're doing our organized on the ground. We're doing our Zoom meetings, as y'all all know, and working and following Rita's lead.
Yeah, thank you so much for that too. And I want to get to Assemblyman Mosley, who's on the call and on this webinar. And thank you so much, Assemblyman Mosley, as you're about to be unmuted, my colleague, Stephanie. Assemblyman Mosley, you've been a staunch advocate on bail reform. You've been really supporting and advancing, sponsoring Less is More, and just really committed to criminal legal reform advocacy work. We want to thank you for joining us. And I want you to share some remarks and comments relative to what we're discussing here today. Thank you.
Well, thank you, Andre, and thank you to all the advocates, and thank you particularly to Legal Aid and Katal. As you know, myself, along with Senator Brian Benjamin, have been spearheading this legislation in Albany. But clearly, with real-time events that are taking place, it really has, I would say, highlighted some of the dysfunctionality that we're experiencing here in Albany, particularly as it relates to CJ reform initiatives across the board. We had a great call with Katal early last week. And at the very end of the call, obviously when you talk about Albany and governing them, you have to include politics. And what was disheartening at the very end of the call, all up to that point, we were pretty much in agreement as to what we needed to do, what needed to be presented, and what efforts needed to take place. But at the end of the day, it takes 3 to tango. And in lieu of what took place with the rollbacks to bail, we understood that this would have a trickling effect on other CJA reform initiatives, regardless of the situation, regardless of what's happening in real time, regardless of what's happening with this pandemic and how it's impacting those who are in our CJ systems, that we would ultimately have to have not only my speaker, but also have the leader of the Senate come to an understanding that, you know, we have to push this piece of public policy forward. But at the end of the day, do we really have do we have someone of like mind and like will? I know the senator is, but I think in the back of his mind, he understands that he has to convince Andrew Stewart Cousins, and whether or not this is the politically prudent thing to do for them. And it wasn't positive. It wasn't something that he thought he could get done. And I don't want to go too far into what we discussed, but that's kind of like the elephant in the room when it comes to us possibly coming back in May, which we're hearing, and whether or not we can, you know, garner enough momentum and support, not only in our conference, but also in the Senate, to push this piece of public policy forward. But I'll just be very honest with you. I'm not going to say they can't do it. I'm not going to say they don't want to do it, but I'm very, very pessimistic that they will do it. So that's where we are right now. We'll continue to push forward. We'll continue to work with the advocates and legal aid and everyone else. But I'm also very pragmatic in terms of what's happening in real time and what are some of these the kind of the political hurdles that, you know, that we're faced with. So thanks again. I appreciate everybody.
Thank you so much, Assemblyman Mosley, for joining this call, just for sharing those thoughts and that insight, which is really important for this conversation. Thank you once again for joining part 1 of our webinar segment entitled COVID-19, Rikers Island, and Technical Parole Violations. We thank all of you for listening to this segment and watching part 1 of the webinar. The next time we join you, we'll be looking at part 2 of the webinar, where you'll hear experts speak more about the impact COVID-19 is having on people that are Rikers Island, especially those who are on Rikers for technical parole violations. We look forward to joining you. Be safe and be well as you join both sides of the bars. And if you're interested in learning more about what the Fortune Society is doing during COVID-19, and you would like to access our services, go to www.fortunesociety.org. That's www.fortunesociety.org. Take care, and we look forward to seeing you again on both sides of the bar.